today's session, we will be focusing on defining multi-agency working within the context of the reforms, and we are thrilled to be joined by Adam Smith from Wirral Council, Amanda Coyne and Donna Tranter from Warrington Borough Council, and Nigel Chapman from Brent Council to explore what this means in practice. So the introduction of new multi-agency child protections teams will bring together social workers, police, health, education professionals to strengthen safeguarding for children and young people. This approach places a renewal focus on collaboration, information sharing, coordinated action across services. So today our speakers will share how they navigate and implement this within their local authorities. And so shall we start with Adam Smith? Thank you.
So I've pulled together there's only a few slides from myself, and just to give a little bit of an overview of what our journey has been like in Wirral as one of the pathfinder in inverted commas authorities. So we've been progressing the social care reforms at maybe a faster pace than obviously wider local authorities outside of those settings. So I kind of joined this role a couple of years ago now, and kind of was delighted already to identify that we had a real strong base of family hubs in Wirral, which is our system where most of our targeted early help teams are working together, already really well co-located with some of our health colleagues within Wirral, supporting families at that point of need at community-based level. So a lot of our Early Help Alliance colleagues would work through the family hubs as well and support families through there. I've worked for this authority for 15 years in social work roles and social work management roles, and actually had a really limited understanding of what was available within our Early Help Alliance and some of our targeted early help systems. So we recognised straight away what we wanted to do was build on the strengths of those systems where we've got families accessing those services and support our social care teams, all under the envelope of family help, which is what the government wants us to move towards, is bringing child in need closer with targeted early help into these family hubs so that families are accessing that support with the right professional at a time where they need them. So within our family hubs, we've got a number. We've actually got 12 family hubs altogether in Wirral, but we've got 4 of our main family hubs within each of our areas across north, south, east and west in Wirral. All of these areas or locations are areas where families can access direct support within these locations. So we've also had a bit of a barrier in Wirral that sometimes our local authority offices where social workers and other staff are attending are not public-facing buildings or areas where we can directly meet and offer interventions to families, which hasn't always been helpful. So we've got social work teams aligned within all of our family hubs directly where they can access communities and communities can access that support. Where I'm using multidisciplinary team terminology is thinking around all of our services within our targeted early help, which includes targeted family support, it includes our early childhood services, includes our domestic abuse hub and some of our youth and play offer. All of them services now are specific in each of those different communities, are working in line with the allocated social work teams in those areas, and also in line with our neighbourhood health model, which is happening in Wirral. Even our North MDT location actually has a birthing suite within the building. So we've got some young people there who are born in the building, accessing school readiness support, accessing maybe some support under child in need. And actually we had one picking up their exam results from there recently as well. So really accessing that throughout their childhood and then being the heart of the community in those family hubs is what we were wanting to work on. The big change that we've had is trying to realign our social care, so child in need and child protection services within those family hubs. And now we've got social workers accessing some of those practitioners with really specific experiences and specific skills around a particular need for a family and being able to access that more readily. But most importantly, we've got some targeted early help workers who are now acting as family help lead practitioners, where families are maybe needing child in need level support, but they've got a good relationship with a practitioner, say in our early childhood services system, or they really would benefit from the most support within a domestic abuse hub. We've actually identified that worker to lead the child in need, with the families obviously being on board and understanding and in agreement with that plan. And we've made sure that there's a linked social worker who is able to support with some meetings if needed, with joint visits, who can step in scenarios where maybe we need to consider some safety planning or some risk management. But again, this becomes a person who is that same person coming on board in their moments for the family, rather than that being a new introduction again and a change of person coming on board for them. Family network support packages has been a big part of the reforms that we've really bought into in Wirral. So we've identified a couple of practitioners who support in identifying what these packages could be for families, but they're effectively trying to help us think a bit differently about what practical or could be a short-term financial package of support would a family benefit from, which may allow us to keep a family together or prevent that further deterioration to a scenario where maybe the family may not be able to be kept together. So some examples of that are, we've recently done a garage conversion for a maternal grandmother of a child, which has allowed them to stay together and have the space for them to continue to reside together as a family, rather than having to look for alternative scenarios. Now, previously, that would have gone down to whether, local authorities looking at Section 17 funding or other business cases for doing that, and is not always something that's been possible before. So we are trying to think a bit more creatively about our Section 17 funding here, have a particular pot of it for family network support packages, with a real focus on that, what plan of the family able to put together, and how can we support that plan that the family are saying, whether that be with some financial support. With the most thing that we've done, to be honest, is supporting families with moving homes. So that may be with initial month's rent and initial down payments that they need to put there. We can also make sure the house is appropriately carpeted, which is often a barrier for families moving into different accommodations. And it just spotted an acronym on there of family group conferences as well. We luckily already had a family group conference team here. We've increased our capacity for that in Wirral through these reforms, and making sure that that's at the heart of every stage of involvement. So at our earliest help in our family hubs, that can be accessed by families now, not just at our child protection levels. Multi-agency child protection teams, or MACPTs. This has been, for Wirral, maybe a longer process for us to get this in place. I know some of my colleagues are going to talk through this in Brent and Warrington as well, but we are now up and running in our east area, which is our busiest area in terms of population and therefore referrals. About 50% of young people on Wirral subject to a child protection plan live in that locality. And what we've brought together in that team is a lead child protection practitioner who is one of our experienced CP chairs. We've recruited internally 2 advanced social work practitioners. We've got a full-time detective constable from Merseyside Police. We've got our virtual school, part-time co-located with the team, but always available. And that's working really well at the moment in our links to our education settings and wider providers within that sector. And we've also got a full-time specialist nurse. Now, this team is a bit more than what our multi-agency safeguarding hub was, or what they traditionally are across the country, in that this team is actively at times meeting families as part of Section 47 inquiries, supporting us, adding some peer reflection space for people when they're making decisions around child protection planning, trying to make sure that we come to the right decision at the right time with multi-agency partner perspectives in there, and that not to be a solo agency decision. And actually explaining that to families that we've got police and health with us working together has been really positive. And also, I think it's supported social work managers in actually having a team they can go to reflect about what steps do we need to take when a significant event has happened or a new referral has come in. How can we collectively own this together in terms of what steps that need to be taken to keep the child and child safe, and ideally the family together in a safe way. I think this is coming towards the end of my slides. Yeah. So the real key parts of this for me in what's helped, co-location is massive. So being able to access our family hubs, our multi-agency child protection team is located within our East family hub at the moment. So we've got staff on the ground building relationships, modeling relational practice that we really want to be offering to families and working with them in the best way. So that's been a real key part of trying to progress these reforms. Our already established systemic practice model has been really important in that, and supporting professionals with feeling confident with curiosity and hypothesizing in safe places, and how we test those. Actually nick some of the ideas from some of the frontline unit meetings for some of that. So we appreciate that support. We are holding regular Q&A sessions and communications around the progress of that and next steps, hearing back from practitioners, but most importantly, seeking feedback from the children and families who are experiencing these changes. What has that looked like for them? We've just recently we've got an ongoing peer review here, and part of that has been, we've been really keen for the peers to link directly in with families and get their perspective on these changes and how they feel it's gone. Co-producing training plans for staff as well. So listening to staff and hearing about what reservations people have. These are quite substantial changes really for a workforce that have been, have massively different experiences of training, of changes of working in this sector. So trying to understand what a training need is for a whole workforce has been difficult, but we've been able to do that successfully by listening to staff and understanding what our data and our audit activities telling us. We're trying to remain as open to challenge and scrutiny as possible. If we've needed to tweak things, we're doing that. And recognizing that this is a journey, we need to keep adapting this to community needs. We've all got timescales towards the end of this financial year in March next year, but we know that even following that, our communities may be impacted by other things. They may change. We may have different demographics that we need to adapt to, and think that this is still an ongoing journey of improvement and to get to that point where we're really happy that all children are safe within Wirral.
Thank you, Adam. So we will move on now to Amanda and Donna from Warrington Borough Council.
So as a Pathfinder, we were under some different pressures, I guess, in terms of timescales to get things up and running. And so we started to make our changes back in October 2024 with a consultation process with a plan to restructure the service. So following that in December 2024, we restructured our teams into family help teams. There were a number of changes that took place at that time. And it was back in December 2024 that we put together the MACPT. I guess I give you this context because I know there's been a lot of kind of queries around how long it's taken to get established with that. And so for some context, we did a soft launch for our MACPT back in April 2025. I'm right, aren't I, Donna? Yes, April 2025. And so there was a period of time in between our restructuring and the MACPT launching that we were able to really kind of understand how this role could be most useful, getting that feedback from the workforce, seeing how our LCPPs, our lead child protection practitioners, could be most helpful. And so we started with a soft launch back in April, slowly kind of bringing the rest of the workforce in the coming months following that. So we are now well established. And so I'll hand across to Donna to tell you a little bit about the team itself.
As Amanda says, we've quite well established now. We've now provided this service across the family help teams. If we can move the slides along to the MACPT structure. So within Warrington, as I say, I'm the team manager. We currently have 4 lead child protection practitioners, and we are looking to recruit a further 2 lead child protection practitioners. We have our education worker, we have DS from the police, and we have Joanne from probation, as well as we have a clinical psychologist from the BABS service, which is the Building Attachment and Bond Service. And we currently have a vacant role for the specialist safeguarding children's nurse, and that was because we piloted it initially on a part-time basis and quickly realised that actually we needed that to be a full-time role. So we have now appointed her, and she'll be joining us very shortly as part of our team. And when you create your teams, you will look at what is needed within your authority. We have a pre-birth social worker as well, because we felt that that was important to look at the pre-birth protocol. But also we have Abby, who is our court of protection and deprivation of liberty social worker as well. But those roles particularly are sort of, a plus for us in respect of Warrington and meeting the needs of the families within our borough. If we can move to the next slide. So we've got a video here, which we are not going to play, but if you want to go to our website, that tells you a little bit more about the lead child protection practitioner role, and tells you a little bit more about the day-to-day role and what that involves. That'll give you a bit more of an idea, so you can go onto the website and listen to that at your leisure. We move to the next slide. Oh, so it's next slide. So the role of the lead child protection practitioner is that they will have case discussions with the family help team. That could be with the team manager or the social workers or the family help practitioners, just to consider what any concerns that they may have, that whether they feel that a strategy meeting is needed. We attend the strategy meetings. Our meetings are held by the family help team managers, and the LCPP will attend the strategy meetings and offer some curiosity around what is needed and what support is needed around that. I know that's slightly different to some other authorities, but we found that that works really well to have an outside sort of looking in and having that sort of oversight and support for the team managers there. where they will meet with the families, they will go through the section 47, and they will support the social worker and the family health practitioner if needed to complete those section 47 inquiries. And that's helped them to sort of, develop their skills as practitioners for those newly qualified social workers, which I think has been most useful. And we found that's been really helpful to those newly qualified. Facilitate meetings to consider whether a child should be made subject to child protection plans. And to provide any support and guidance throughout the whole of the child protection process. So in the old process, the conference chair might meet them at the beginning of the meeting, in the initial meeting, and then meet them 3 or 6 months later. The LCPPs will have an ongoing role within those families to consider what is needed and to provide that additional oversight that they may need as families to prevent drift, really. Obviously, sometimes things don't de-escalate. Sometimes they might have to escalate to pre-proceedings or care proceedings, so they will offer that expertise alongside that for the social workers as well, and any support they may need. So we have a dedicated police, obviously, and I'm going to focus on just the parts about the MACPT because these are slides from the police, so there's 3 slides on that. So the approach in the MACPT is to be hybrid working, so the DS will be with us as a minimum twice a week in our office, but is always available to us full time. So they will always attend the strategy meetings. So we have that sort of dedicated person that's familiar with how we work, and so that we're getting our thresholds right, but also where they're not available and somebody has to step in to support, they're sort of like on a rolling basis within Cheshire Police. So we know who those people are to provide us that support. And as I mentioned there, they're in the office with us at minimum 2 days a week. So the aims are to strengthen collaboration with us in our working relationships, to reduce unnecessary requests by assessing the risk. So this has been really useful when we will considering, do we need to hold a strategy meeting, or is it just information that we need to make an informed decision about a decision or how we're going to respond to any sort of instance that happened. So that's been really helpful and useful to be able to sort of reduce the risk of those strategy meetings where needed, but also to provide those team managers the sort of, the guidance and support to say that it's okay to hold that for now, and for us to go away and find some information before holding a strategy meeting. And I think that's been really, really helpful. And the police have been really involved in those decisions. So as I mentioned, we've got an education inclusion officer. So again, they will provide support to the family help team managers and the social workers, offer consultations, attend home visits. They will help support the social workers to navigate that understanding around education and what that means, but also to provide their sort of, overall support to consider whether there is a risk and it needs to be at child protection, or actually is it something that there's some additional support that she can offer. And that's been really useful. One most recently was a family that was subject to child protection. Parents insisted on homeschooling the children, so they weren't being seen on a regular basis at all by any professionals, and she was able to go in and explain the importance of the education and actually achieving those outcomes. And those children, 3 children, are now in full-time education and they're being seen by professionals and obviously reaching their full potential. So that's been a positive outcome for that particular family. So I mentioned our building attachment and bond, so our clinical psychologist. So she will offer support in respect to obviously attachment and looking at from a trauma-informed lens, offer consultation and with social workers and the family help practitioners, but also offer a lot of reflective space as well to consider what it is we need to understand about these parents or this family to, where possible, to keep families together. And we found that particularly useful with working with our pre-birth assessment social workers, to consider whether, we do need to separate at birth. If not, how can we support that family if there is the risk, but also if we do, what it is we need to do and be able to offer them for that support. So as I mentioned before, our health nurse has actually just been, so our safeguarding nurse has been appointed now. She'll be joining us very shortly. But what we have found within, the pilot was that actually we do need somebody there full time. So what we found was actually working 2.5 days a week was we actually felt that it was needed a lot more, so that she will be coming to us as full time and offering, as I say, those joint visits, looking at health assessments, but also attending strategy meetings and considering him from a health lens point of view as well. We also have probation within our team, and very similar to the rest of the multi-agency, they will offer consultations, complete visits where needed, support with any risk assessments and assessments that are needed. And in particular, our probation officer is a specialist in sexual harm, so is been able to offer support with our social workers completing risk assessments and protector assessments for our families as well, to reduce those risks to the children that we're working with. Obviously looking at the behaviours and offending behaviours and how to reduce those risks as well. So we've come to the end of the slides now, and what we wanted to sort of share is what are our families telling us about what's happening. So some of the observations that we've had and feedback was that you can read there at your leisure, but in particular one was particularly helpful in respect of coming together at our we call them initial decision making meetings instead of the child protection conferences. And this mum particularly felt able to share the concerns that she had about coming to those meetings, how frightening it would have been and confusing, but actually she felt very held, that professionals all came together to support her, and she felt that we were there to support her and her family. So that was something that we was really positive about. And then finally, we also completed a pilot with our Speak Up service, which is our advocacy service that work with our families that have potentially learning difficulties or learning needs. And the feedback that they provided to them was that they really enjoyed meeting the lead child protection practitioner before the initial decision-making meeting, having the report before the meeting to go through it with them, having one report. We only have one report now that includes all the multi-agencies' views for that meeting, so they're not having to read through several reports repeating the same information. They feel that they have a greater sense of involvement in the meetings, and they feel that the language that we're using feels different to them. So we try to have that sort of systemic base to our meetings.
Thank you very much. So we will now move on to Nigel from Brent Council.
Just a few headline overview from me of what Brent has done and where we're at in implementing the reforms. We're not a pathfinder, but we've taken some fairly significant steps to set up our Families First programme, although we're not at quite an advanced stage as either Wirral or Warrington, who you just heard from. So the first couple of slides here, just for context, if it's helpful, we'll just give you that overview of what the partnership programme is, what the role is of the DFE in setting the guidance, and where local authorities fit in with that as well. I think it is, though, speaking from my perspective as someone who's worked in the sector for probably a long time now, it is a welcome focus on prevention and a reset of resources through to earlier in the system, and to try and move us away from multiple child protection investigations, children coming into the care system. So I think that is a welcome approach, and it's obviously down to us all individually in each local authority to work out how we best implement that. So our approach is to, in Brent, we're thinking about, this local design of the system, but thinking of it as the whole. So where families come to one of our family hubs, we call them family wellbeing centres in Brent, all the way through to the end of our system if you are in care and as a care experienced young person as well. So yeah, we're trying to move towards that system of prevention whilst keeping children safe. So we're not driven by numbers. We're not saying, we have to have a target of X number of children on a plan or in care, but we hope that by resetting and refocusing on preventative work, then that is what we will see. I think we're probably, at an early stage where we're seeing certainly our looked after children numbers are below England and stat neighbour averages. Child protection plans at the moment are not yet coming down, but we think that might be an impact as well. And the idea is that we design that system, we design it locally with our local population, not doing two, So involving the voices of parents, carers and young people in that as well, and bringing partners on board. So a couple of things about that in a minute. You might recognise this slide. I've slightly adopted it from the DFE one, but it just does give you a really helpful overview on a page really about, the continuum of help and the integrated system and where we are, with that kind of dotted line in the middle being families first really, and the intervention there. So targeted early help joining up with child in need work, and also with child protection as well, with those multidisciplinary family help teams, lead practitioners and multi-agency child protection teams as well, with family group decision making sitting across all of those. So yeah, the idea is, we've got fewer handoff points within the system, and that's the intention. I think it is a useful one for you to have tucked away, just to kind of, you sometimes get a bit, as I do, confused about exactly what it is we're doing. It is helpful just to have that in your back pocket. So we've created family help teams now, had them in place for about a year. We're definitely seeing that targeted early help and social work support being more joined up. We're seeing better conversations, fewer kind of conversations about transferring work, thinking more holistically. I think certainly for practitioners who may have been more in the early help space, they're becoming more confident, I think, about what they can do and how they can see themselves joining up. So for alternatively qualified practitioners, I think this provides a great opportunity for them to develop their skills. Family network meetings, we've created the family group decision making process and a team around that specifically. So that voice of families earlier in the system is starting to happen. And I think the partnership side of things, we're probably a bit more complicated in London, because we have the Met Police that covers 32 boroughs. They don't want to do things 32 ways. They'd like to do things as much as possible in one way. That's tricky. And we've also got a health system which is quite fragmented and covers multiple local authority areas. So we've had to do a lot of work on working with our partners to get on the same page. So the development of multi-agency child protection team working has been a bit slower. Well, because it relies on us working with others. It's always a lot easier, isn't it, to go, what do they say? If you go on your own, you'll go fast, but if you want to go far, you have to work with others. So I'm hoping that we can go far by investing the time now in working with our partners. Like it says there, it's early days, quite a lot's untested and not evaluated at the moment as well. So we're a little bit in the unknown, but so far the signs are good.
Thank you very much. So we'll now come on to the host Q&A. So I'll start with the first question, which is about implementation and practice. So as we've not got much time left, could one of you please answer, can you share an example of where the multi-agency approach has made a significant difference to the outcome for a child or family?
Yeah, I'm happy to share an example. I mentioned it with the feedback there was being in an initial decision-making meeting, as we call them, rather than an ICPC, and the one where she felt really, really held by the multi-agency. So we had the social worker there, the lead child protection practitioner obviously there, who was chairing the meeting or facilitating, as we say. School education was there, health was there, police obviously was there. And what this mum is telling us that actually she felt that able to share, what she had experienced in this significant domestic abuse relationship, but so much so she was able to share more than what we actually knew prior to going to the meeting. But what it did is the support she got from the multi-agency was a real clear plan about where she was going to go. And actually for this family, what that meant was that she agreed to go into a refuge and actually keep her children safe. And I think, but apart from that, from what she had experienced previously, and working with the local authorities, she felt very much held and not judged by what she had experienced, and that everybody had something to say in the meeting to offer as a support for her and the interventions. So for me, this is the whole key thing, is keeping families together, but making sure that each individual professional has an input into those plans and really, open to that with the family. So I think that's definitely a good outcome for that family.
as Donna spoke earlier, you can see that each authority is going to be creative in their own way around who they bring into that MACPT. We, of course, want our key agencies around the table, but it's also a time to think about how to be really innovative with that. For instance, we have a clinical psychologist in our team, and some of the work that she's been able to do to completely rewrite the way that we talk and think about families, and therefore the decisions that we go on to make around next steps, has been so unbelievably helpful for not only us, but the long-term impacts for the families that we work with. I'm just thinking of one just off the top of my head where, you know, we could have been headed down potentially a placement order with one particular child until we were able to do this really robust piece of work with her father, who, due to the input of our clinical psychologist, was really able to make sense of his experiences, some of the addiction that he'd experienced too. And so the consequence, you know, of her involvement was so drastically different to what it could have been. You know, we could have headed down a completely different route with that child. So really thinking creatively about who we want around the table, who's going to aid the way that we talk and think about families, I think is really key with that as well.
Thank you for that. So we'll move on to the next question. So how has your local authority created and embedded a shared culture and sense of purpose across professionals from different organisations?
I touched on it in terms of the what's really helped us in Wirral, and I think it really has been around getting to that physical time together for different professionals from the multi-agency and multidisciplinary elements within the local authority. So that co-location just, I don't think, could be replicated as well kind of without it. So that for me is kind of modeling positive relationships, working together, shared responsibility, shared risk, and shared decision making. That allows us to also model that for our practitioners who are doing that with families and trying to work in, you know, in a relational way, partnership, listening to the families about who is best placed to support their, you know, lead their plan and be their family help lead practitioner, and being clear that that doesn't always have to be a social worker. That's been, you know, in some ways, we've maybe had some anxiety from some of our partners, such as education colleagues around that sometimes, or, you know, understanding about why that's the case. But we're kind of 2 years into that cycle now, and I think we've got other partners as well recognising the impact of the changes and what positives that is bringing to this.
Thank you. And then the last question, what lessons have you learned that would be the most valuable for other local authorities preparing for similar reforms?
I think don't feel pressurised into, you know, doing things too quickly, because there's a lot of pressure in from the DfE to see return on investment. But I think we have to remind ourselves that, you know, the Pathfinder and the learning from the Pathfinders is only really just coming through. And you know, this is, the messaging has been, you know, it is down to you locally to determine how best to work. So there is a bit of withstanding the pressure to show immediate results, because we know long-term investment takes time to show results. It can show some immediate results, like we've just heard about in Warrington, but the sort of systemic change that we're looking for here is going to take time. So I would say hold your nerve in terms of setting the systems up, and take the time to, you know, really kind of think through what it is that you're aiming to achieve. And the other second point would be, you can't communicate enough why we're doing what we're doing with our staff, because you might think you know it and everybody's heard it a million times, but 1,000,001 times is how many times you need to communicate what it is that we're trying to achieve, and have a really simple message about a theory of change that people can really understand and get behind. It does help that everybody is doing this. So if you have staff who are thinking, oh crikey, you know, this is a bit turbulent, I'll go somewhere else. Well, everybody's doing this. So there isn't a kind of a quiet place to go, but it's exciting. So I think there's a bit about energizing, talking about the possibilities, but communicating why we're doing it and the benefits we're expecting to achieve, so that everybody can be taken with the journey. You're not doing it just to implement change for change's sake. There's a purpose, and it has meaning, and it will lead to lasting change.
Thank you very much. Thank you. So we will now come on to the audience Q&A. One question is your MACPT located within a hub or in a separate venue? And if it is co-allocated, how has this been received by families who have a history of distrust with social care?
So for us, are at the moment where we've done our kind of test and learn areas in East, and they are co-located within the family hub. We've not had any negative experiences of that up to now in terms of with families. So what I would say is families aren't kind of walking into the building and the MACPT are in that same room. There's different areas of that building, but they're aware of kind of where MACPT are based if they've had involvement with them, and that's happening. But I think for us, there's a real importance in that accessibility of MACPT to the family help system and that wraparound approach that MACPT offers when we've got child protection concerns. So I do think it's important.
Thank you. Got another question. Do you have any partners, for example, schools or health professionals taking on the role of family help professional?
Lead practitioner.
Oh, okay. We don't have
yeah,
those acronyms in my authority.
I mean, it's a new one for the reforms, isn't it? I'll jump in quick for Wirral. Initially, we don't. All of our family help lead practitioners are practitioners from within our targeted early help system. A big kind of, and I know some of the reforms has talked about that certainly earlier in Pathfinder, but I know a lot of the Pathfinders have kind of fed back to the DFE the real challenges to that. Some of it around that systems access and making sure that there's consistency in terms of what the offer and support is to families at child in need. But I think also capacity within the wider system of partners to lead at child in need level, and also making sure that we've accurately got that scrutiny of data and understanding of progress and QA. So it's not something we've progressed in Wirral. We probably don't have plans to progress that at this point here.
Yeah, from a Brent perspective, our plans are to use local authority staff in that space and then work closely with health and schools and settings to sort of build around, rather than initially anyway have people from those disciplines kind of leading. Not to say it wouldn't happen in the future though. I think it's just about getting things off the ground and then seeing how it develops.
Thank you. And another question we got was, how have you begun the process of rolling out this in teams? Was it a phased approach? Where did the previous social workers who helped sin and child protection go following the new structure, and how did you decide this?
So in terms of for Warrington, it felt a little bit of a big bang as a Pathfinder that we had to make a lot of changes quite quickly and all at once. But actually, on reflection, there has been very much a staged approach as we've gone. In terms of the question around the family help lead practitioner, so we still have social work teams. I guess I'm feeding from that question that there's an understanding that everybody else kind of was then put on a back burner, and that's absolutely not the case. So case responsibility still remains with social workers or family help practitioners in Warrington. The role of the LCPP is to enhance that, to offer an additional layer of expertise, I guess. So it's not a case of taking work off those who are already working with families as lead practitioner. That's certainly not what we've done in Warrington. In terms of how we've brought the changes about, we started by setting about our family help teams, which were our social work teams. And in the initial stage of bringing in the role of family help practitioner meant that we utilised workers who were already very much within our system. So for us, we had an innovation team who were able to bring across and act as family help practitioners, knowing that we knew their practice, we knew their skill set and experience. And over time, we were able to kind of now branch that out. So we ran a pilot for an early help social worker who was linked to one of our locality teams, similar to Wirral's model. And we're just in the process of expanding that out further again, so that those in early help will continue to kind of hold child in need cases with the oversight of social worker from our who'll be a kind of bridge between the teams. So yeah, it's been very much a staged approach, although it's not always felt like that, I think the workforce might say.
Thank you. And then our last question, what is one key message you would like attendees to take away about multi-agency child protection teams and the opportunities they present for safeguarding children and young people?
For me, it's additionality of sharing responsibility around risk and that extra reflective voice. is I think what I would say we struggled with in Wirral a little bit is maybe some people's perceptions of it. Is this just further scrutiny on social work team decisions, or is this like just another layer of management making a decision? But actually it's very collaborative. It's coming together to support timely decision making, and that there's effective multi-agency involvement and voice within that as well, and making sure that the family decision making and family voice is at the heart of that. So for me, it is that additionality to reflection and shared decision making.
I would say make sure you know who are the people in the room who make the decisions. Police are obviously very hierarchical, so you need to make sure you've got someone in the room who has got the authority to kind of make changes as you develop your system. Because it will just get passed up the line from my perspective in terms of the police. So you really need to be clear, who in your own leadership is kind of having those conversations, who can kind of make sure the right person is there, who can make decisions, and also be part of the cultural change that's needed as well. And the same to a certain extent goes with health. I think you need the right people there who are kind of system conveners within the health system, whether they work in your ICB, whether they work for one of your health providers, who also are willing and able and have got the kind of impetus to want to change the system as well. So, really kind of understanding who are your key people who, as probably we're in a position where we're still developing, and that's, investing the time to kind of get those foundations right, getting the right people in the room and having conversations to be clear on what is our shared vision here will pay off. I think we're in that process at the moment, but certainly we're spending the time in digging the ground at the moment. So I would say do that. You can't over prepare the ground.